Monday. I'm very motivated to be back at home with you. For those of you that have followed me the last few weeks, I have been all the way across Canada and back, 4,235 kilometers one way and then back. So I'm glad to be back into some routine, starting with a session today. Sorry that I missed you last week. This month is a very important topic. It is Pain Awareness Month. And I don't know if you're aware, but there's other people out there living their lives every day with pain. Sometimes it's chronic, sometimes it's a short-term thing. But I want to talk to you today about how whole body vibration can help you manage the aches and pains of daily life, or aches and pains that you may be dealing with from chronic or medical conditions. So pretty big topic we're going to get into in a short period. I want to leave a little bit more room for Q&A at the end. For those of you that are joining me today, please let me know where you're joining me from. If you are here out of interest for yourself, someone that you're caring for or have a relationship with, I want to hear about the type of pain that you're managing. And if you are using a vibration plate now to manage pain, please let me know what your little hacks or your tips are. I'm going to offer a few no-brainers today that pretty much anyone can accomplish, regardless of where your physical health is at. But I want to talk a little bit first about why whole body vibration is good to help manage pain. And the simplest answer that I can offer you is for a lot of the same reasons that it's, exercise is good for pain. So increasing circulation and lymphatic fluid through exercise, how much velocity you have or effort you're putting forth towards that exercise is going to vary for everyone. But exercise, we know. Hello, Stephanie. Just got one, plantar fasciitis and perineal pain. I don't know if I'm getting the word right or if that's a typo, but plantar fasciitis is way up there in the top common things that a lot of people would use whole body vibration for. And that's actually one of my examples today is how do I use it for plantar fasciitis or why? So a lot of times when you're dealing with pain, if you're not using ankle pain tendon. Thank you for Stephanie for clarifying. A lot of the stuff that you would use your vibration plate for, if you have a level of comfort, is maybe going to be different than, if you're looking at it for the first time and you're dealing with pain now. So if you're dealing with super chronic, horrible pain right now, something like a vibration plate would probably be something that might make you a little fearful. How can something that shakes me help alleviate my pain? And what the biggest thing about using a plate for pain is how to use it for pain. So, if you are dealing with pain, limited mobility, things like this, how you use a vibration plate can very much be modified over someone that might be using it for weight loss or strength, and exercise type of exercises. So there's a lot of range in what you can do on a plate, and most of you struggle with where to get started. So if you're using it for pain, it's not necessarily a big workout. It's about alleviating the pain before we get to other things. Does it help with balance? Diane, it absolutely does help with balance. Your body is kind of ever stabilizing itself on this moving surface. So your proprioception, all kinds of things improve very, very quickly just by simply standing on the plate. Balance is kind of one of those side benefits I refer to. It's one of the first things that will improve in using a vibration plate. And in a lot of my therapists and a lot of the medical applications I work with, we sometimes use the plate to get the person more stable before we get into more elaborate exercises or in complement with other things that we're using for therapeutics. So improving balance there's really nothing special that you have to do. But just like exercise and your goals, how bad the balance may be is going to dictate maybe where you start on the plate. So if you're dealing with someone that's got very, very poor mobility, we're very weak, perhaps someone elderly that's recovering from a fall or something like that, there's not only a fear factor, but if balance is poor, we wouldn't stand them on one leg and close their eyes as a starting point. I'm going to get into a few basic exercises and give you some of the basic benefits as to why vibration can help with pain. But I do invite questions today in general about whole body vibration under the bigger umbrella of, the benefits of, and pain management is a very big, commonly discussed benefit. Mary is here from Kansas. She has MS, spasticity, and lower back pain. A lot of folks with MS have embraced vibration machines for, again, some of the simple things like better blood circulation. It's going to help you relax. It's going to get your blood oxygenated. Dr. Terry Wall is a very well-known MS researcher and has that condition herself. And she swears by whole body vibration and has done a fair bit of education on that as well. She's a Lifepro user, and she's a shining example of how the right lifestyle and the right tools can really turn some of these conditions around. I have Nancy here as well. Hello from Lexington. Just stepped off my Rumblex. My main purpose was to increase bone density for osteoporosis. Another very common benefit. Bone density is a little bit of a longer term benefit or goal set, I would say. But anything, building our bones is about bearing our weight. And one of the great things about a vibration machine is it makes weight bearing exercises a little bit easier to the user, a little bit kinder to the body. And in essence, you can get a little bit more done in less time. So if you're also dealing on top of the osteo with things like arthritis, joint swelling, joint pain, MS pain, it all is kind of offering different benefits for different reasons, but you don't have to necessarily do different things on the plate to get different benefits. So I want to get into a couple of very basic exercises. If you've never listened to me ramble before, I do ramble, but I always recommend having a stool, a bar height stool if you're an adult, a chair if you're shorter or dealing with a child. And the reason that I recommend this is if you are dealing with fatigue, poor mobility, it's kind of a safety issue, but it's a way to use the plate and expose your body and modify it from standing to allow you to perhaps do a longer treatment time, maybe warm the legs up before you do some standing. So if you are dealing with below baseline, whether that's due to pain, which is what our session is about today, or for any reason, traditional exercise presents a challenge for you, whole body vibration may just be the solution. Certainly is an option worth exploring. So this is my trusty dusty stool. And the reason I like it to be a little bit on the taller side is when you put hang on, I did something. When you are seated on a stool with your plate on the floor with your feet on it, your feet are raised off the floor 6 to 8 inches. So depending on your height, you want to compensate for the difference. So if you were sitting in a chair, we all know proper posture is sitting at a 90-degree angle. You don't want to be going downhill in a slumpy old sofa, but you want to be at a good 90-degree angle or slightly higher for a couple of reasons. And starting seated reduces the amount of body weight you're committing to this exercise. And just in the very basic movement of oscillating, all of Lifepro's plates offer oscillating movement. So oscillating, hang on, sounds like I'm on the cord here. I was clicking the cord. So all of your, the foundational, the basic movement of whole body vibration is what we refer to as oscillating or pivoting movement. It's a very much mimics walking, but with much, much less impact. And the reason, if you're unsure, if you're dealing with pain and you're considering a vibration plate to manage it, I don't want you taking on more than you're ready for. And the first question that I'll address that comes up, there's never the perfect way to use a vibration machine for every situation. Just like if you were to go to a gym and you wanted to start a program for weight loss, let's say, there's lots of different pieces of equipment. There's lots of different trainers. There's lots of training styles. There's lots of different classes. There's never one definitive path to success. So with a vibration plate, think of a vibration plate as an environment. It is an environment that makes floor exercises easier, less impact on the user, and it also has the potential to reduce the amount of time that you spend exercising. And it does it through these micro movements. So even though I'm just sitting here, I'm on the basic starting speed. My legs are moving back and forth. Speeds or levels, as you increase in the range on your machine, you will feel it moving faster. And sometimes when you're dealing with pain, one of the things I want you to consider when you're starting out on a plate, generally we think of starting slow. And any of the recommendations coming with your plate do outline start slow, be conservative in time. But if you are dealing with pain, what I would suggest you try as a starting point versus a slow speed is a mid speed or even a higher range speed, but in combination with a closer foot placement. So two things that you control when you're using a plate that moves like this: the speed it's going or how many times it's moving you, but the distance between your feet or your hands on the plate increases or decreases the amount of movement. So think about like a teeter-totter. You know, if you're the little dude sitting on the end versus sitting in the middle, how much you're moving with each movement of the plate varies. So the biggest thing to keep in mind if you're dealing with pain, regardless of what it's coming from, MS, fibro, surgery, whatever is causing pain for you right now, is the first lesson is bring your feet closer to the center, even dead center, just to sort of get a feel for what your tolerance might be. When you're dealing with pain, especially if it's chronic, it's going to vary from day to day. And what you might find works today may not work tomorrow. And what works tomorrow, you may need to change as your recovery or improvement in your chronic pain progresses through using these plates. So start with your feet a little bit closer and try bringing it up to a mid speed. The reason I suggest this is the faster you're moving, the less choppy it's going to feel. We had a question a little bit earlier about balance. The really slow speeds on a vibration plate are more typically associated with balance, stability, proprioception. And these are all things we want to work on. But if you're below baseline, perhaps you've just had a stroke, or you've got bruises all over your body from a fall. The slow speeds can be uncomfortable, especially in combination with a wide foot placement. Your skin's shaking around more. So bring your speed up to a mid-range, whatever that is on your platform. If you've got 60 levels, bring it up to a mid-range. If you've got 99, bring it into the mid-range of that. The speeds are just ways of breaking the increments down to give you adjustability for what feels good for you. So play within ranges. It's never an exact number. And, certainly if you are dealing with pain, I don't want your feet any more than hip width apart. I'm going to use an example from one of the questions we've already had about plantar fasciitis. Plantar fasciitis is something that can stop you from doing many things. When your feet are in pain and they're hurting, it's hard to even walk across the floor to go to the bathroom. So just by sitting on a stool with your feet on the plate, you're going to increase circulation. You're going to loosen tension in the muscles. But there's a couple of things that you can do. There's exercises you've probably been shown to do specifically for plantar fasciitis. Little things like calf raises, or maybe you want to stretch the calves. But by just starting with the plate to warm up those muscle groups, all these little micro movements are going to get circulation and lymph moving to release tension, but it's going to oxygenate the muscles. Endorphins are released when we move our body and we exercise. So, again, it's very much the reason exercise is good at managing or preventing pain. Vibration plate is a tool to give you those same benefits. It just is a little bit kinder if you are dealing with traditional pain, chronic pain, pain from an injury, whatever the pain is. A vibration plate just makes it much more tolerable. If you're dealing with anything other than foot pain, maybe it's hip pain, leg pain, fibromyalgia, and MS, those quads, what you kind of want to do is positions that are going to engage those specific muscle groups. So I want to use the quads as an example, simply because between MS, fibromyalgia, restless leg, maybe you worked out too much at leg day at the gym. There's lots of reasons that our quads and our hamstrings carry tension and pain. So just standing on the plate, I want your knees slightly bent at all times. You'll notice the taller you stand, you can even hear it in my voice, you're going to drive all the movement up to the head. So you want your natural shock absorbers kind of kicking in. Those knees are bent. You want good alignment. And what you'll feel when you're standing, you'll kind of feel your tummy wiggling around in the hips a little bit. But if standing is uncomfortable or painful, the same lesson applies when you're seated. Bring your feet closer to the center. And if you're dealing with poor balance, maybe you want to have a chair in front of you or a wall to hang on to just to give yourself something to ground. But the key when you're using a vibration plate isn't the speed, isn't the move. Those are important factors, but the number one lesson is the distance between your feet. That controls the intensity. Wide is more movement. You'll feel that change instantly just by changing your foot position. Close is much more mild. It's much more tolerable. And what the level of comfort isn't so much a cookie cutter equation that I give you. It's what feels good for you. From here, I want to evolve to one variation. We talked about the quads, and just by bending the knees and standing here for perhaps 1 to 2 minutes, you're going to feel a lightness develop. You're going to feel probably a pins and a needles. It's very common if you're just using a plate for the first time, or you're getting back to using it after a while. That tingling is most commonly an increase in circulation and lymph, and it may be more prominent in areas where you have nerve issues, lymph blockage, swelling, things like that. Low back. So let's move up from the legs. If you did want a little bit more time, 1 to 2 minutes, perhaps 3 minutes, specifically for pain management, you can do something like this throughout the course of the day, whether it's standing or seated, when symptoms present themselves. It's not always a set time of day. Pain comes on when it comes in. Sometimes it's triggered by something that you've done, just your tasks throughout the day. So strictly as a pain management, as a therapeutic tool, you can use a vibration plate whenever you feel you need a fix. But you're not doing a whole program. It's 1, 2, 3 minutes as a spot treatment. So for low back, I'm going to give you a couple of options. If standing is okay and the level of pain allows you to continue a little bit further, or perhaps you'll notice it's actually improved a little bit, I want you to bring your feet a little bit closer if you haven't done so already. When we're targeting the low back, the spine, I've never met your back. I'm not sure what you're dealing with, but you want to reduce the movement. The thighs and the hips can take a little bit more action, but I don't know about your back. So let's test it first. What we're going to do is we're going to straighten up our legs and lean over. Our legs are not locked, but they're as straight as you can get them without locking the knees. And you'll feel, I want a straight spine. You'll feel in that low back and the hips. This was thighs. Now you're going to feel, just by changing the angle of your standing position and experimenting a little bit with how you stand, you're going to feel the stimulation sent to different areas. In this case, it's in the low back and the hips. And for those of you that deal with back fatigue, chronic back pain, perhaps you're dealing with scoliosis, there's a million reasons you might have spine pain and back pain. Standing, this is probably the easiest exercise that you can do, again, whenever you feel you need a fix. It may feel natural to want to go a little further. As long as you feel stable and comfortable, it's completely fine to do that. But don't bounce, don't do anything, just relax, let your body hang from the hips, and only work within your own range of motion. If you're fearful, I've already rambled for 10 minutes. Look at that. Let's keep it going. If you are fearful, you're suffering with poor balance, that same bar height stool is a really good tool just to give you some support. So we're going to do that same position. You can lean your hands on the bar stool just to give you a little bit of stability. And if you have range of motion, you can even come a little bit further. Play with your angles. You can lean forward. You can lean into it. You can shift your weight left or right. I encourage you to experiment with your angles, how tall you stand. You'll learn very quickly how to get it to the spot where you have the tension. Everybody's a little bit different in where that back pain presents. And, the more you play with the angles, you'll learn how to hit and target that area specifically for your needs. So that's another good reason to have a stool. Other reasons that vibration plates are great for pain is if you do suffer with pain, it's a chronic condition, but you're the exercise guru now, you push through it. It's really ideal in general, just as a warm up or recovery for other things that you may be doing now. If you live with chronic pain, you're dealing with MS or fibromyalgia, you still deal with exercise pain, that buildup of lactic acid. And a vibration machine can be a really great way to warm up muscle groups, expedite the blood flow, and dissipate as a recovery tool. It's going to help you sleep better, which is a big part of your recovery as well. If you're not getting good sleep, your body's not doing that repair at night, and you're going to pay for it the next day. So I want to switch back here to questions a little bit. I could ramble for days, but I know there's lots of different questions that you may have. Let me see here. Best speed for back pain. Okay, so Deb, there is no best speed for back pain, but what I would say is there's never a best speed for any one condition. Everybody's different. But I would say if you're dealing with pain, as I said at the beginning of the session, a mid speed, but with a closer foot position. The biggest adjustment to make when you're dealing with pain or you're just starting out for the first time, all the control is in your feet being close or wide. We think of starting slow as a speed thing. I prefer to say, let's start conservative, and bringing your feet closer to the center reduces the amount of movement regardless of what speed. There's never a black and white scientific answer. It's going to vary for everybody. In my experience of a decade and a half on these machines, a mid speed as a better starting point when you're dealing with pain, but you need to ensure the feet are there to make up the difference. The mid speeds are smoother, less choppy, and less jarring, especially if you are dealing with chronic pain. Let me see what else. How does a person use the plate for upper body pain relief? Can I stand and just help that, or are there modified positions preferred? Yes, there's absolutely ways. This is Facebook user. I don't have your name, but if you're dealing with chronic pain, there's usually a direct relationship with a poor range of mobility, or if it's upper body, it's getting yourself up off the ground that may cause issues. So I just want to show you one more modification. So again, have this bar stool handy. What we're talking about is using the vibration plate. Is it possible to use it standing to get upper body relief? So if you're dealing with degenerative disc, if you've got frozen shoulder, tendonitis, whatever it may be, yes, obviously applying certain body parts directly in the form of a push-up or something, it is an option, but I would like to talk more to the general public and show you things that everybody can use. The easiest, laziest way is in this starting position with the stool, and there's two options. Take your hands and add them to the knees, and you'll feel a very slight movement in the shoulders and the neck. How intense that is depends on your feet. If they're close, it's very subtle. If they're wide, it's much more intense. So you've got to decide what's comfortable for you. On this one, I suggest locking up the elbows. You're not bearing your weight on the machine. And if you bend the elbows, you kind of lose it. So you want to lock the elbows. And if that's tolerable and you feel, well, I could take a little bit more action, the next progression would be elbows. So bring the elbows over onto the knees. And again, if you find it too intense, bring the feet close together. If you find you want a little bit more action, widen the feet. And again, as a setting, I would recommend a mid-speed setting just to get started. I think you'll find, especially if you're just dealing with things like neck tension, those slow speeds are very choppy, very rattly, and the body tends to guard and protect. What you want to make sure, especially with upper body for my ladies, we have a tendency to carry our tension, our bra, our purse, and we tend to fight and resist the stimulation. So just relax, have a nice straight neck and spine. If it feels good, you can turn your head, roll your shoulders, whatever you might do sitting at your desk. All you're doing is making the vibration a part of the equation to give you more benefit through the increase in blood flow, circulation, and it's going to really boost and help relax tension in the muscles, the tendons, the ligaments, things like that. So, and again, as whenever you need it, if you have chronic pain or tension, you're living at a desk on a mouse all day, you might find you're doing this for a minute or two every hour. It's completely fine, and it's completely different than doing an upper body workout where you're killing yourself for an hour. That's a completely different level of effort. This is simply for therapeutic benefit. So those are the two options I would recommend if you are able and are restricted in your mobility to get down. If mobility isn't a concern, again, we're talking upper body pain relief. This is not about doing the meanest push-up. If you've never done a push-up in your life and you want to use a vibration machine for upper body pain relief, I just want to make sure that you can get down and, more importantly, up off the ground comfortably. If this isn't something you have an easy time doing and you struggle with now, don't make this the first thing that you do on your machine. You want to make sure the range of motion is there, and standing positions are going to be the best way to build that up. But to get into upper body, same lesson applies. Reduce the distance between your hands. You don't need to be wider is not more benefit. That it's been said that way for years and years and years. Wider is more movement, more intensity. I prefer, and again, this is just my preference and my experience, I prefer a closer hand placement in combination with a faster speed level. So bring it up to a mid-range. Put your hands just close together, and I'm sitting on my legs. If this isn't comfortable for you, you can sit on the floor. But I just want you to kind of get a feel for it before you put any body weight into it. And you can feel just by putting your hands on the plate, something simple like this is going to get circulation to the hands, the wrists. Maybe you're dealing with carpal tunnel. But what I'd like you to get to is a modified push-up. So we're only on our knees. So body weight is very, very minimal. And the big trick with upper body is getting the shoulder in line with the hands. If your head is above your hands, you're going to get the most head vibration. It's not harmful, but it's something you need to get used to. Your nose will get all itchy, and we have a tendency to fight and resist it. So just relax, get your shoulders in line with your hands, and you'll minimize 90%, 95% of the head movement. And where you want it is in the neck and the shoulders anyways. So back here, you're feeling it in the head, a little bit in the shoulders. But if you just push your body forward slightly, you'll feel it in the neck, the shoulders, the shoulder blades. And depending on where the pain is, again, experiment. Maybe you're doing some shoulder rolls. Maybe you're turning your neck. Do whatever you're doing now for relief in those areas. You're just using this to add extra stimulation, lymph circulation. If you've got a plate and you're doing exercises now on it, and you do struggle with pain, maybe a little bit of a warm-up is all you need to make the difference, to make it not only a better workout, but by warming up and using this as a recovery tool, you don't need to suffer through the pain after. It's going to help minimize it. So this is the best way to start, just getting used to how it feels for upper body, and keep it simple until you start noticing some pain relief. And you will. Once you start noticing relief, then you can progress to more challenging exercises should you choose. The very last way that you can get upper body relief is sitting on it. So if you've never sat on your plate before, that could be a 5-hour session in itself, as to the benefits between, oh my goodness, we're going to have to cover a few of them, but pelvic floor strength, incontinence, there's all kinds of different reasons people sit on the plate. Today we're talking about pain. So upper body pain, by sitting on the plate, you can take your hands and tuck them under your thighs. And it's just another way to get some stimulation to the upper body, like in the stool or in the modified push-up. But while you're sitting on it, you're also getting the benefit of movement to the hips and the spine. So this is a little bit of an all-in-one. You're getting relief to the hips. You're getting a hamstring massage. The spine is seated in the middle of the plate, so you're getting very little movement, but you're getting adequate blood flow and circulation to help manage the pain. If you sit a little taller, you'll feel it more in the neck and the shoulders. If you're sensitive or just don't like the head vibration, just lean forward slightly and you'll feel it leave the head, and you'll play with your angle to see what the comfort zone is to get it into your neck and shoulders versus your head. And for this one, intensity, just like when you're standing or you're placing your hands, if your legs are really close, you're not feeling as much movement. If your legs are wide like a V, you're going to feel that intensity increase. And the biggest lesson I want you to leave with today, if you don't remember anything else I said, when you're dealing with pain, it's about modifying what we refer to as amplitude, bringing the feet or the hands closer to the center and get the thing going a little faster. And I think you'll find it'll be a much more pleasurable experience. Okay. A lot of people have poor experiences on vibration machines for the first time. Not because they're harmful devices, but we either take on more than we're ready for in the foot positioning and we spook ourselves because it can be very intense, or we go too long. That's, just because a machine has a preset of 10 minutes, if you're joining me today and you're dealing with chronic pain, you are not what I would call a baseline person. So if you're dealing with chronic conditions, you shouldn't be doing cookie cutter 10-minute programs. You're going to pay for it. But the machine can help you undo the wickeds of over-exercising. So if you have overdone it and you can barely walk today because you way overdid it on your vibration machine for the first time, reduce the intensity of your feet, sit your butt in a stool, and try modifying and just using it for a minute or two to offer relief. It's the going too long that created the situation that you're in. Okay. Hip flexor pain. Lauren, standing and doing the low back one that I covered here, even just sitting on it. If there's any exercises that you do specifically for your flexors now, get creative. This is just an environment. 99% of the floor-based exercises you're doing now with modifications sometimes can be done on a vibration plate. All the machine does is offer an environment that makes that position more effective in less time with potentially more benefits. So if it's very severe and range of motion is an issue, Lauren, try some of the seated things that I went over at the beginning of this live. Neuropathy pain in my feet. I never thought you'd ask, Maria. And I jumped over a couple of questions here because there's a few more. Hang on 2 seconds. Best be for back pain. Has a person used plate for upper body? Okay, that's where I was. Is it advisable to use the machine with fibroids? Africana, it really depends on the fibroids and where they are. That's a very big general question. So I deal with a lot of fibroids. It's not a contraindication. But if for some reason you have been advised to avoid activity, in my experience with fibroids, it's usually high impact activity that can cause pain, regardless of where they may be. But this is a low impact thing. So sometimes a reason a vibration machine is better for activity than traditional activity is because it's less impact. So a lot of people have luck with it just simply because it's less impact. If it's somewhere where it's causing other symptoms, bleeding, maybe it's an internal thing, I really would prefer input from your doctor to see if activity is ideal. The only precaution there being is there's a huge increase in blood flow here. So if we're not to be increasing blood flow and you're supposed to be just resting, some of the modified things where you're seated in the stool, you may want to avoid applying that body part directly, depending on where the fibroids are. But it's not a contraindication. It is a common sense approach, though. So if you have any more details, if that hasn't covered it, let me know. And neuropathy pain. Okay, I did talk about hip flexor. Let me introduce you to my neuropathy tool. Very scientific thing called a pool noodle. Neuropathic pain in the feet can really, really vary. So the worst pain with neuropathy can feel like somebody's drilling a bazillion nails into your feet. Some are dealing with no feeling at all. And what I want you to be very cautious with when you're dealing with neuropathy, atrophy, any of those sensation issues is if you are numb and you lack sensation, I want you to be very diligent on your time exposures. You do not feel it if you are overdoing it sometimes. So keep it short. The biggest thing I'll tell you with neuropathy and where you'll be successful with it is using the machine frequently in short sessions and let those symptoms be the trigger. So if you're feeling 5, 6, 7 times a day, it's getting number, that's a clue to use your machine if possible. Movement and an increase in circulation is usually the way that you address that now. But as neuropathy progresses and proprioception, and sometimes we get unsure of ourselves and we have bigger fears. We don't want to fall. We don't want to have an accident. So the best way to use it for neuropathy pain is simply the way I started, which is seated. Okay, so, use this to get some sensation back, manage the pain, whatever the neuropathy is presenting. The reason I show you the pool noodle is a lot of times, and this is true for plantar fasciitis as well, the arch of your foot and underneath the toes doesn't actually come directly in contact with the plate. They're moving, but I like to use this, and you can use a full pool noodle. This is just one that I've cut in half, or use some of your Lifepro rollers on the floor as well, your vibrating rollers, just to get into those nooks and crannies. And again, this is just a stimulus. So all the machine is doing is increasing circulation and lymph. It's kind of like what do you do on the floor now when your feet are going to sleep? You wiggle them around. You do all kinds of things. So add the plate to that equation. If there's stretches you're supposed to be doing, calf raises, whatever you're supposed to be doing for your neuropathy, there are exercises. It's the diligence in doing them. So consistency is really the key with neuropathy, swelling, anything like that. You want to use this device regularly to get that blood flow, oxygenation going. And if the neuropathy is due part to tight muscles and tension, it's going to address that as well. So 2 to 3 minutes. And I think you'll find with your feet closer to the center and a faster speed range, you'll get more done in less time, but it's going to be more tolerable, especially if the pain is very severe. Easy peasy. Okay, I hope that helps, Marie. Lauren, I did talk about hip flexor pain. I need some beverage. I have a cool new stainless steel coffee mug. All right. What do you recommend for severe knee pain, technique, stance, etc.? Heather, it would really depend on severe knee pain. Really doesn't define to me is there a tear in there? Should you be exercising now? Or is this just a chronic thing that you're living with? So with any pain, if it's a right now and you're not supposed to be exercising or doing anything, we want to make sure we're doing the best course of action. But if this is a chronic thing that you're just dealing with, I would suggest looking at there's got to be exercises or stretches that you're supposed to be doing now for this. Again, the machine is just an environment. I happen to have a little bit of a soft spot for the whole bad knee pain thing because that's how I got into these years ago. My favorite tool for severe knee pain isn't so much a move or a routine, but it's getting stability in the joint. A lot of times with knee pain, the muscles have become weak because we're afraid to do things with our knees, or they've become unstable. So again, I don't want you standing if standing exercises are comfortable for you now, but seated, there's a little ball I have here, and you can also use the pool noodle. You can use the yoga swirl. Actually, I like this better. If for any of you using these, the smaller one, I want you to wedge that just between your thighs above the knees and get your machine going. And this will put your feet a little inside, hip width apart. But what this is going to force the legs to do is hold the swirl in place. So it's going to help strengthen the inner and outer parts of the knee where you may be having some deficiencies. But if you take it now this way, you'll notice in these there's a ridge. You could do this with a rolled up towel if that's all that you have at home. A lot of my knee pain is in these outer tendons and ligaments. And I used to roll on the floor, but on the machine now, I just put that right between my knees and I kind of just roll it around while I'm getting the stimulation again from the machine. If you are able to stand and you're doing standing exercises, you can do the same thing just standing. But, with knee pain, with any kind of pain, again, I want to simplify this and say, just doing what you physically are able to do on the machine, getting that circulation and lymph going is going to help alleviate the pain. If it's a structural thing in your knee and you shouldn't be exercising or weight bearing, there still are ways to use the machine, but I would suggest something more like a seated type exercise or something more along those lines. If you're unable to bear weight due to your pain, it's not always that doctors recommend no exercise, but you may need to modify the activities that you're doing now. And there's lots of ways you can do those modifications on the machine just to get the pain relief and keep the exercise pieces going. I hope that makes sense, Heather. Stephanie said, my unit is good, brand new, and loving it, just trying to figure it out. Experiment. You are only limited by your imagination and your range of motion. Again, I wish I could give you a cookie cutter routine and setting for every single condition on the planet, but you guys are all different in your lifestyles, in the body that you're dealing with, in the body you want to get to, and those goals. So, it just like walking into a gym, there wouldn't be 10 different trainers and 50 other pieces of equipment if there was one road to success. This is just an environment that takes a lot of fundamentals from many different types of exercise modalities and makes it easier with less impact in less time to you, the user. Let me see here. Nancy, what mode are you using for the Pilates and yoga routines? Again, I don't talk modes, I don't talk levels, and there isn't anything specific for yoga. Again, there's preferences. I will say that's probably more in Roseanne's wheelhouse, but what I would suggest is it's more based on the type of exercises that you're doing. So for me, if I'm doing balance and core exercises, I prefer using the lower settings in oscillating to destabilize. As I said, the lower settings are more destabilizing. For strength, endurance, a little bit of cardio, sometimes some dynamic movement. As far as preset cookie cutter settings, I'm going to defer and say there isn't actually an answer that I can offer. It really depends on the exercises that you're doing. But if you are looking for the specific yoga and Pilates settings that Roseanne recommends, I suggest maybe looking up one of her series. Again, she's got her own style, her own way to success, and she's more of a yoga and Pilates resource than I am. But that would have been probably discussed in more of hers. Today, we're talking a little bit more about generalities and using the machines for pain. Kim Johnson, hi, Debbie. Thanks for your continued programs to help us. It's always great to learn a new tip or two. Thank you, Kim, for joining us. I hope it's nice in Houston today. Hope to get back there someday. I didn't get to spend enough time, but I did enjoy my time there. Nancy again asking, what do you use for yoga or Pilates? I can't offer a definitive answer. We're not here to discuss yoga and Pilates today. That's absolutely up Roseanne's wheelhouse. And again, it's going to be different settings. There isn't one ideal setting for any one exercise modality. So I'd prefer, and I'll maybe tag Roseanne in this one after the fact, but if you're not following Roseanne's sessions right now, she has done a number of awesome sessions specific to that. I suggest you check some of those ones out, depending on what your goals are. Gilbert, I have a Rumblex Max program and or position to relieve sciatic pain by the back of the hip mid-calf. Gilbert, I can relate. I've just come off a round trip of 4,200 kilometers across Canada, and I've been sitting way too darn much. My favorite way to deal with sciatic pain, especially if it's severe, is starting seated. So if you didn't see this, Gilbert, at the beginning of the session, what I call this is just seated, but we're going to do another variation that's called the nerve floss. And I believe you said, I'm not sure if you said left or right side, but I'm going to demonstrate the right side so that you can see this better. What I want you to do, you can hang onto your stool, put your hands on your hips, but I want nice posture, nice strength, head right down to the spine. And I want you lifting one leg straight out. You're going to flex that calf and you're going to feel a stretch. So that's the first part of the position. And Gilbert, depending on you, this might look different depending on your own range of motion, but you're going to feel a stretch in the calf. While we're doing that, I want you to look upwards towards the ceiling in time with the leg, okay? So we're going to go like this. We're going to go lift, two, and you're going to feel that in the calf like you've never felt it before, Gilbert. But make sure you do both sides. Even though you might be feeling sciatic in just the one side, the other leg's doing all the compensating. It's doing all the work, so give it some attention too. Lift. And, depending on you and your level of pain, 2 to 3 seconds. If you can hold it 5, great. But I don't want you holding it so long that you get a Charlie horse or a cramp or something, okay? You can do this anywhere, seated in a chair, seated off the edge of your bed. But by adding the plate again, we're ramping up that circulation, that lymph, and we're just giving us more benefit, same position, in less time. So I just want to show you that again. We're going to lift. This leg is straight, How high you lift really depends on your own range of motion. Try that, Gilbert. If you have more range of motion and you want to get a little bit deeper, the variation seated would be what I call a figure 4 stretch. You're going to take this leg. Actually, I'll do it this way to demonstrate. I'm going to take this foot and you're going to place it just above the knee on your thigh on the other leg. This leg is straight up and down. If you have the range of motion to do this, I don't want you looking like this. I want my posture maintained, and we're going to push forward with the chest, and you're going to feel it all the way there. That's not as much as on the calf, Gilbert, but this would be kind of the second step. You're going to get right in and feel it into the glute, and then I want you to add a little bit of pressure on the knee. Just hold that for 2 to 3 seconds. This is really good for the hip flexor too, whoever brought that up earlier. Lean forward. And again, you can do this seated in your kitchen chair, your office chair. It's just more effective. And do this whenever you start having those symptoms. Don't leave it till the end of the day. If you have access to your machine throughout the course of the day, or if you're heading out for the day, do some of these things before you leave as the preventative piece. Don't wait until you're suffering to use the machine. I hope that one helped, Gilbert. Try that one out and let me know if that works out for you. Okay. What else here? Oh, really? Yes, I am coming. Just go away. We just ignore them, Nancy. That's what we do because they want attention. Piriformis pain. It can. I wish I knew a little bit about why we're dealing with piriformis issues. I don't know if you've had a recent surgery or if this is something that you're chronically dealing with, but same guidelines apply. If you have any specific exercises or stretches that you should be doing now, that's usually a really good starting point. It kind of depends on your range of motion. And if it is something recently related to surgery, there's going to be different issues. But I would suggest same kind of approach. I wouldn't maybe do that last stretch that I did, but just standing on the plate is going to help get the circulation and the lymph to those areas. Maybe a little pelvic tilt while you're standing. It really depends on your level of pain, but just getting stimulation to those areas is going to help with the tension. If it's not a surgery situation or recent injury situation, and it's just common chronic pain that you're dealing with, consistency and more frequent use is going to be the key with any of these things. So, 2 to 3 minutes as you need. It's not always a big bad program. It's as those symptoms worsen and present themselves, that's your clue to use the machine to offer some relief. I hope that makes sense. Who else did I have here? I hope that answered your question, Facebook user. Gilbert says, thanks. Never thought about sitting on a chair, usually standing. Standing's okay as long as you can tolerate it. But if the sciatic is severe, sometimes just even standing on the plate, you're already done and it's not even moving. I have a really cool chiropractor that I've dealt with for a number of years, and he's very familiar with my technology. He's got a plate. And a lot of times my local clients will call me and say, like, I can't even get in the car to go see Dr. Dean. And some of these things I'll suggest that you do just to get into the car, or so you can go for the bigger adjustment. So, a lot of times vibration can be used as a precursor to other treatments. So if you're like really, really, really hurt and you're trying to just go see your therapist, even just a couple of minutes seated, just to loosen you up so you can get into the vehicle. There's a million ways that you'll find you can use this just to improve that quality of life if you're dealing with these really, really severe pain issues. Host, the YouTube account has been blocked. Thank you. That's okay. It all helps. I wish you had better questions. Who else do we have here? So that was Gilbert. Some W, 60 years with CMT symptoms, losing muscle for balance training. Any suggestions? The easiest way, if we're talking proprioception, I don't know if you're losing muscle mass due to a condition or due to lack of activity. Atrophy is sometimes, it causes our muscles to deteriorate and in essence die because we have, neural issues. But if we're just weakening due to inactivity, just getting started is the best way to battle that. Depending on where you're starting at physically, if you're dealing with weakness or fatigue, start seated in a stool just to at least get a feel for the plate and know what you're kind of signing up for before you stand on it. But the best way to improve balance training without getting into elaborate exercises and give you a blanket answer is to close your eyes a little bit. So whenever you're standing on the plate, close your eyes for like 2 to 3 seconds, and it forces your body to rely on the other senses. We're very heavily reliant on our sight. And when we take it away in an environment that's moving back and forth, it forces our body to kind of kick into overdrive and really, really challenges the balance. But balance in itself is really kind of a side benefit. You just have to use the machine in a standing fashion, and you'll notice very quickly improvements. If you deal with fatigue or pain in standing, again, get started in a stool, or maybe do a combination. Maybe you warm up for a couple of minutes in the stool and stand on it for 30 seconds to a minute and build up from there. Just a suggestion to you some. Nancy, I know, right? I blocked. Thank you, Nancy. Facebook user, I think I've been sitting too much and not stretching before walking. You know what? I'm guilty, especially this time of year, of not warming up. I think that I'm bulletproof now that these machines have changed my life, and I'm not overweight and limping anymore. But I am really bad I'm just going to go outside for 2 minutes, and then I'm in the garden 8 hours later, and then I wonder why I'm dying later. Yeah, a couple of minutes. It doesn't always have to be your big workout, but 2 to 3 minutes before you're in the garden, before you take the kids to soccer, before you go to work. It doesn't always have to be a big workout. Keep it short and simple. And for a lot of this, if you've recovered and used a vibration plate successfully to manage pain, use it for prevention. Just because you're feeling better doesn't mean you should stop. It'll come back. So Africana, thank you so much. I appreciate your depth of knowledge so much. Love from Calgary. I'm in Didsbury. I'm 45 minutes north of you. I haven't been to Calgary lately. But yes, I used to have a studio there back in the day on 16th Avenue. Nice to see you. Nancy R., I use painting extension rod for stability when doing foot raises and some. I love your creativity. I love using brooms and paint sticks. I like to put it behind my neck and do like little stretches and things like that. A mirror. If you tend to shift and lean on one side and you want to pay attention to alignment, put a mirror in front of your machine. Even one of those cheap ones you can get for $20 for the back of your door. Put it in front of the machine and you'll see if you're favoring one side over the other. All these little tricks. But yeah, broom handle is a cheap thing that everybody's already spent in some way, shape, or form around the house. And it might offer you a little stability, or a pole, a ski pole, something like that, just to give you a little bit of ground. You're welcome, some. Carell says, hi, Debbie. Lots of love from Isle Wallow. You never beat an Islander. Oh, nice. I'm wondering whereabouts this is. I was just in Eastern Canada in New Brunswick. So I've seen lots of the country. I wish I could make it south to the States again here for a road trip soon, but we'll see what the future holds. What else am I looking for? I hope I answered all of your questions there, some on the CMT. What else? No, Isle Wallow. Oh, Isle Wallow come. Okay. Is that Canada or is that the US? Let me know. I'm not familiar. I've never heard before. But thank you for joining us and learning about pain today. I'm almost getting to the 1 hour mark. I've rambled a bit today. I've only shown you a few very simple things, but the biggest thing I want you guys to leave with today, for those of us that are just joining, rewatch and go back. As soon as this is done, it will be a recorded video in Lifepro's video arsenal. But the biggest way that whole body vibration can help you with pain is just by simply having a relationship with your machine and using it regularly. And don't beat yourself up if it's not the big workout. Oh, I didn't do my planks or my squats today. Just using the machine for the basics of circulation and lymph is going to release tension. It's going to manage your stress. It's going to help you sleep better. It's going to help you poop better. There's a lot of different reasons that you're dealing with pain. And sometimes we look for, how do I what do I use the machine for and what level for fibro pain, or how do I use it for MS pain or degenerative disc pain? Sometimes it's about getting back to that root cause and what's causing the pain or what contributed to this in the first place. Sometimes it's doing an exercise or a position that targets that area. And the more you can experiment with how you stand and the little angles you do while you're on the machine, the more you're going to learn how to direct it to where you need the attention, because it's going to vary for everybody. And the other thing that varies is your own individual tolerance. So, what my tolerance is after using the machines for 15 years and your tolerance is might be very different, not because I'm stronger or in better shape, because I've been using it longer. I can assure you, through 2 children, 2 pregnancies, all kinds of medical conditions, all the special needs I've dealt with, I have never hurt anyone in the course of using a vibration plate. I've over-exercised a few people, but those are the lessons that you learn when we're trying to. I'd rather you contact me, Debbie, I'm in pain today because I overused my machine, than I'm in pain today because I didn't use it at all. So if fear is holding you back, I hope I've given you some options today that take the fear out of the equation and just start conservatively, not slowly. Get those feet closer together, get the speed up a little bit, and sit in a stool and just get used to how it feels and progress accordingly. Use it more often to manage pain, and let me know how some of these tips work out for you. Next time, discuss, not enough info out there. That's a good suggestion, Nancy. I will look into that. And if you'd like, if you do have suggestions of topics, I can ramble on for days, but I don't know what you guys are dealing with. I know in my own wheelhouse and my experience, but everybody's dealing with different things that hold them back from living that better quality of life. So please let me know what some of those are. Nancy, send me a little bit of a note with some details, and I'd be happy to look at a session in the future. If there's anything you'd like me to cover in future sessions, whether it's pain or exercise related, I do like to specialize in the application of plates, but the only thing I love more than vibration plates is some of the other amazing tools that I can combine to just give you more results. So send me some info, Nancy, about your specifics, and I'll get into a little bit more detail in a future session, maybe next month. In Canada. Oh, okay. I'll have to look up where that is. Hopefully I wasn't close by and just drove past you. I wish I could have seen everyone that I know along the way, but I had a destination in mind. I was away from my desk for a month, and I'm very happy to be back here with you. Next week, we are going to be at hopefully an earlier time. I think we're going to be looking at 2:30 Pacific, 5:30 Eastern. And if you can't make the scheduled lives, never worry. The minute that I stop rambling, this is a video in the Lifepro YouTube channel, as well as their Facebook pages. So if you're unable to watch it now, or you want to go back and your head is spinning because I talk too much and you want to go back and see something, you can always see these videos in their library. And if you have questions, even after watching the recorded version of this, tag me in the questions here, and I'll come back and answer those if you were unable to join me during today's live. So if you're not able to be here live and in person, never worry. Tag me in person, and I will make sure I get an answer back to you. Can't believe you've never heard of Ice Wallow Cum. I haven't. I'm from Alberta. Have you ever heard of Didsbury? But no, I have never heard of it. So it's on my brain. I got to go look it up now. Thanks for joining me regardless, and nice to see more Lifepro users in Canada. Thank you for joining me. I will be here next week with some back to school stuff, getting back into routines, back into the habit. That'll be next week at an earlier time of 5:30 Eastern Standard Time. So I look forward to seeing you guys next week. Don't work too hard, and have a fantastic week.